if we start with Councillor Harris.
Okay, thank you. All right, I should just point out as well, because you've been missed off, is I'm actually chairman of the Health and Wellbeing Board in Dudley, which is the main partnership that actually brings together social services and health services, and is driving towards trying to integrate them and improve services for people of all ages. That's why I was really pleased you asked me to speak. Your question really kind of highlights a gap in people's understanding about how mental health should be approached and how we should be developing services to approach it. Because you start with the question of mental health cases being treated predominantly by referral, and that's because people perceive, and they're quite right, that GPs are the gateway to mental health services, but actually that's only a small part of what goes on all the time in both local authority and in the NHS. There's actually 4 tiers of mental health services. So the first one is about prevention and early intervention. The second one, which often gets referred to as tier 2, is actually about actually bringing in early intervention services which provide mental and emotional health services, particularly for children and young people. Sometimes that takes place in schools, sometimes it's services provided by the Clinical Commissioning Group, which is the NHS body that provides your services. Then there are specialist outpatient services, often referred to as tier 3. And what happens there, they're usually, you really are then well and truly inside of the system. You'll be dealt with and looked after by a multidisciplinary team or a service, either in a community mental health setting or in a specialist psychiatry outpatient service setting. And the 4th tier, which only affects very few people, is specialist inpatient services. And that's where people become so poorly that for a time they will have to be put away. What can I do as a politician to ensure that you're safely looked after, supported in the right place at the right time? I believe I do it by trying to refocus the services that you get so that actually there's lots of tier 1 and adequate tier 2 services about. Because I don't want you to get to the 4th tier. Because I know that as a young person, if you become poorly and get to that stage, the odds are if you go into that tier of services, you may spend most of your life then in and out of the service, and I don't want that to happen to you.
I've realised that in my excitement for the panel, I didn't actually read out the question, so I'm going to do that now. Yeah, just in case, with mental health cases being treated predominantly by referral, a strong stigma surrounding the topic mental health and the threat to organisations that offer support to young people with mental health issues, what can you do to ensure the safety of and support for young people suffering from mental health issues? Moving on to Councillor Neale.
Thank you for inviting me to the debate. I have a lot of experience with mental health. I used to work as a prison nurse, so I have seen it at its worst. My main issues are there's 1 in 4 of us that will suffer a mental health illness, and it can be from depression up to the highest, such as schizophrenia, or even further than that, which you need medication. The main thing is, as a politician, is to promote prevention. Prevention of people getting into the tiers, as my colleague here has just said, is very important, that we don't go down those tiers. So identifying the signs is very, very important. And us learning that it's not a stigma to have depression or to feel upset or to feel low, that should be ruled out. If somebody goes and breaks their arm, people can see it. If somebody has a mental illness, you can't see it. And it must be identified that it's okay to go to somebody, especially for young people, and there should be open access places, which there are, instead of just going to a GP who's an older GP who's just going to put you on medication. So we need more intervention, and we need to use more multidisciplinary partnerships as what the Health and Wellbeing Board are trying to do at the moment. And the question here, you know, what can we do for support, is just that. It's about partnerships and about not being stigmatised. And also the pressure should be relieved from schools and colleges, and there should be easier access to mental health centres, drop-in centres, so it shouldn't be seen as a problem. It should be seen as an illness instead of a problem. And you know, it is okay to say that you don't feel very well, that you feel sad. You should never be stigmatised with mental health. Thank you.
Okay, well, I actually think it looks like I've written this question, because this is what I'm asking within my job all of the time. I'm a psychotherapist, having worked in the voluntary sector for some 29 years and managed a project. And what I would say is that mental health, there is a crisis with mental health. It's a huge crisis. We see 110 young people a week in our surveys, and we have around the same levels of young people waiting for counselling on our books. A waiting time for CAMS, which is Children and Adolescent Mental Health Services, is between 9 to 12 months. So when we talk about how we want to stop people from being admitted into hospital, there's something radical that needs to be done. Because if we don't invest more in young people's services, more young people are going to be going into hospital. Last year, 53,000 people were detained under the Mental Health Act. And I don't know whether anybody saw last night, there was a programme on Panorama last evening, which was talking about the crisis that there is for finding beds for people in mental health units. And you know, each mental health unit was having to decide which was its least ill patient, and to get rid of that patient out of the hospital in order to take on new people. When we talk about the tiers of services which you've been talking about, Rachel, when I first started working in counselling, we had people referred to us who had mild anxiety, a mild phobia. Now we have people referred from hospital to us who've tried to commit suicide, who are self-harming every day, who have severe depression. And, you know, it doesn't make any sense to me to not invest in young people. It costs very little for people to come to services like my own, a charity, and there are charities all across the country delivering that. It costs a lot of money for people to be funded through mental health services. On average, if a young person is admitted to hospital through A&E, it costs £1,800. It costs £25,000 a month to keep someone in a mental health unit. It can't be sensible to not invest in mental health. And what I would say could change it is young people actually putting pressure on everybody, putting pressure on the government and putting pressure on services to actually, and local authorities, to invest more money in young people's mental health. Because if we don't, we will reach crisis, and the tiers that Rachel's talked about will be absolutely nothing. 95% of our referrals come from GPs, and I would expect that so in a lot of other projects as well. Well, that has to be paid for by GPs and local authorities. It cannot be paid for by charities. And as a CEO myself, speaking for CEOs working in voluntary sector projects right across the country, we can't take the full responsibility for everyone's mental health. People have to give us the money to be able to do that. So yes, there will be a crisis. with 18s to 25s in this borough, there has been a decision that the services, counselling services will not be funded for them anymore. That actually what young people want is online counselling services. If you don't want online counselling services and you have members of your family that don't want that, you need to protest about that. It's very, very important. Because online can be very useful for some young people. For others, if they're isolated already and they spend most of their time in their bedrooms, feeling really depressed, they need something that actually helps them to move out of that. The place of safety sometimes becomes a prison for them within their own homes. So please think on about it, and please keep doing things like you're doing tonight and raising these issues in debate. It's very important that you have a voice. Otherwise, decisions will be made for you, and all that will be left is online services. And, then we'll have an even worse mental health crisis. Where will the 110 people that we see a week go? Where will the people who are on the waiting list in projects right across the country go? Make no doubt about it, we're in for a real big problem, and we're already in it actually. Thank you.
Okay, so as someone who has been treated through a referral, they are helpful, but when you go to the doctor and they get told you need a referral, that 3 minutes waiting is the worst 3 weeks of your life. Because you just sat there, you've got no idea what's going on, you don't know what's going to happen, and it's absolutely terrifying. So I don't think we should stop colleges, because without college, I would never have made it to a doctor or to a referral. But I also think that we do need to fund the voluntary counselling, because I know people who have been through that system and that's helped them so much, and they're so much better now. And again, with the online counselling, I think that is helpful for some people, but for other people, human contact helps them, because part of their problem is that they can't talk to people because they have social anxiety, for example. So them going to counselling itself is a step towards helping them get over it. So if I was just to get online counselling, that wouldn't help me, because my problem is face-to-face contact with people makes me feel sick. So for me to go to a person and have contact with them, that is what I need. And if I'm as someone in the 18 to 25 bracket, if we stop funding that, then that's it. The people like that, they won't get any better, because they won't have the chance to talk to people about their problems. And just talk to a person on the internet, while many people, that's totally fine and that's going to work for them. But for people who need to work on their human communication, the voluntary counselling is essential. So we need to keep that going. Yeah.
Okay, quite a lot was said about stopping the stigma by, teaching people it's okay to feel sad and it's okay to have a mental health issue, there's nothing wrong with it. But apart from yourself, I personally, and I don't know if I'm just talking for myself, didn't really hear an answer or solution to how that's going to be done and how Duffy Council is going to work towards doing that.
Yeah, there is work going on primarily through the schools. We're doing a whole set of things through public health to try and get the way that people think about these things, the way they approach working with young people in a completely different way. That includes, we have just, for example, recommissioned the school nurse service. So people have a view of school nurses, and older people particularly think they're the people that look at things and sit you on a bed when you need an aspirin. But what we've recognised is it's actually about providing a whole raft of emotional as part of the health and well-being of young people. So with the new services coming in September, there will be a different approach, and we specifically commissioned a different provider so that you'll have somebody you can go to that you'll be able to talk to, that will understand the system, that will be able to pinpoint if you maybe need a little bit more than a talk or some support to help you get through things. So we are changing the whole way that we deal with services at that level to help you feel supported. And we're also doing additional things such as we offer training for teachers and for non-teaching staff in schools so that they too can recognise how to support and work with young people, how to approach things so that they don't give out that general stigmatisation. So there's lots and lots of work going on at present to change the way the system works.
Yes, we've got a minute for each answer.
Totally agree with my colleague here. We do work quite closely together, even though on opposition, we do work closely together. This mental health issue, we don't want to go into crisis in Dudley. Yes, we are trying to start prevention instead of getting on to actually having a mental illness. And if the idealistic thing would be is to identify the signs of mental illness. If people are staying in their rooms longer, friends aren't coming out and speaking to you, there's no eye-to-eye contact. It's important that people are aware. And as my colleague Rachel has just said, it's there. The schools and colleges, it's there. It's not appropriate to send a teenager to A&E in an out-of-hours service or anything like that because they just don't get the right care. So it's important that we alleviate that and they are given the appropriate care for their needs and also work together as partnerships.
Okay, any questions from the floor on anything that's been said?
12 months, and then 12 months to that.
Any questions from the floor?
I think it's great that you're going to put in place that help with prevention and getting people to understand when their friends are acting differently. But I just wanted to know, from personal experience, I think the hardest part was saying to somebody that you have a problem, and I think when I had a problem, a lot of my friends didn't notice that I was any different. And I just wondered, how are you going to make it better for the people themselves to realise they have a problem and that they can go and talk to someone and that they can ask for help?
I was just sort of going to add to what that lady's just said. It's interesting that you talk about how we're providing one service or another service, so voluntary sector, GP surgeries, and it's interesting that you are talking about how it has to be one or the other. And I think something, as we've debated this in the Youth Council, it's been interesting that actually we've realised you need to have a mixed solution. One size does not fit all, especially with something like mental health, which actually affects every single person in this group, because we all have a brain, so therefore we are affected by mental health services, because actually they only look after people who have a negative response. It can affect everyone, as you said, 1 in 4. What are your solutions, and what do you think, how do you think you can make that work, that actually you've still got that variety of services to make sure that everybody is catered for, especially given the budget constraints at the moment?
Any further questions at all from the... Yep.
I was just wondering, you put a lot of weight towards towards educating within the educational system. I was wondering if there's anything being done to educate at home, helping parents understand how to help young people.
Is that all of the questions? I'm not coming out again.
Only for 3, gosh, that's 3. Yep. I think you've made a very good point there around young people themselves not noticing if they're poorly and their friends not noticing that they're not as they should be and they need some support and help. What we need to do is not just work with schools to get teachers to spot things. We need to work with teachers and health professionals so that we can work with you as well. So as part of your PSE lessons, part of your day-to-day activities, we help you to recognise when you're not feeling right and to have the confidence to say, that's not right, I need to go talk to somebody about it. I know that's simplistic, but actually, our colleague there, your colleague there, actually put his finger on it. Everybody's different. Everybody, when they become poorly, may need a different set of things to happen to them. The important thing is that you are at the centre of the service. And that is happening, that is being recognised. Because when you enter mental health services, they are so broad and so wide. You'll be dealing with the NHS, you'll be dealing with local authorities, you'll be dealing with the voluntary sector, you'll be dealing with the educational authorities, you'll be dealing with different sections inside the NHS and local authorities. So actually, the most important thing is that we move things so that you get what you need and we get services to recognise that. And that's my job as a politician on the Health and Wellbeing Board, to stop all these services going, oh, you've got to do this, you've got to do that. Actually, the person that needs the service is the important person. We need to design everything around it. In terms of health at home, there are lots of, again, we're entering into a world where we've got lots of disparate and different services that pick up at different points of people's journeys in life. But in terms of support at home, for very troubled young people that need extra help that may be recognised already in the system, then the rest of the family support system should also kick in. And we do work with troubled families, we do work with people who have more extreme issues and emotional issues that we have to deal with through the family. We have a whole force out there that works specifically with family. But again, it's back to the point the colleague put out. The service has to be at the centre of the person concerned, and it doesn't matter what age you are, whether you're 0 or 6 months or 25. That's what we should be working towards.
Right, I'm probably going to replicate what Rachel's just said. Yeah, recognising signs. I appreciate what you're saying. Your friends may not notice, but if you start going downhill, they will notice, because you will have a different behaviour. But if you feel that other peer groups are noticing and you feel down and you don't understand why, there will be an open door. It should be made aware in services that there is an open door. Like your group, you've got counselling groups, you've got voluntary services, you've got the internet. You can always look on the internet and there's groups there for you if you feel that there's something not quite right. And again, you could go to your parents as well. But there is always a GP surgery which we're trying to get away from, but there are services there are the voluntary groups. So you must make aware for yourselves that, you know, sometimes it's not given to you on a plate, you have to go out sometimes and find it. The concerns I have is that if it's out of hours, then there's a problem. That's my main concern. So if it's an out of hours problem on a Friday night, that's what we must be tackling as well. So you come home from college or university, wherever, I'm speaking for the youngsters here, it's important that those services are made available as well. But recognising signs is important, and people that have a mental health issue, people will notice around you, and if not, there are services there for you.
I resonate with what you're saying there, that sometimes people don't actually know that things are changing. You know, when we think about young people, it's a big time of change. Adolescence brings lots of change for young people. And sometimes we don't actually know when we're growing up. Remember when I was growing up, sometimes I think, is this right, the way that I feel? Is this not right, the way that I feel? So I feel there should be more out there to educate people in the terms of that you could go and look and think, is this something that I have? Is this something that is happening to me? The fear is, you know, it's like if you look in a medical book, you can always see that there are things that you probably have wrong with you which you don't have at all. So I think, you know, to be able to ring people or have a look on, Young Minds have a fantastic website that you can kind of go on and have a look. And, you know, ask people or, you know, ring voluntary sector projects, ring statutory projects. So start and ask, you know, you don't have to say who you are, you can start to ask about it. I'm sorry, I feel I'm rushing my answer, but I'm trying to answer three questions. I think with around parents, there is a lot of work that could be done with parents. For 3 years, we had some lottery funding and we worked with parents, and it was fantastic to be able to do. Because often things don't change within a home for a young person unless you can change the home environment. So, you know, I applaud anybody that can find any funding for it. We found funding for 3 years for it, and then the lottery said, no, we need new things, we need new innovative things. But, you know, parents are still parents, and new parents are coming along all the time, and they still all need help. I think about working in silos, working together is really, really important that we do that. And I'm going to say to you here, because I think this is really important tonight, we've worked with a project over in Wolverhampton. We work with children, and we've just got some funding to work with children in this borough, from 5, as you've said, to 25-year-olds. Won't be in every school, but we're hoping to pilot it in this borough, as it has been there, and then to put pressure on funding for that, because there's a huge gap in those. From 5 to 13-year-olds, there's a huge gap in the borough. And if you want to address the stigma, which was part of the question, start young. Start working with people when they first start to have problems, and start working with families. And that's how you start to address that stigma and problems from, you know, developing. And then people can say to the parents, I have a problem, can you help me? Okay.
I'm going to start with parents. So, as me personally, my parents were really good, but I don't know if that's just because I'm really close with my parents because it's just me, or because my mom has mental health issues too. But I never really felt like my parents weren't doing anything wrong. They were doing everything wrong. They were doing everything right. But as for friends, as far as I know, none of them really noticed. But they're in this room, so I don't want to be really rude to them. But as far as I'm concerned, not any of my friends noticed. But I also know that you get really good at hiding things, and you get really good at pretending. Oh yeah, it's great. Oh, that's a really good day. But I can't remember the question. Like the mix of services. I think that would be helpful, because someone could feel like they were getting ill, and then having the early steps would be really, really helpful, and you don't have to progress until you've snowballed and everything's going wrong, for someone to finally be like, oh, you should go see someone. You can get seen as soon as you start to feel like something's going wrong, and then that would prevent people from entering into the worst case scenarios, and then starting it earlier, and prevention is better than a cure. Yeah.
Okay, and with that we come to the end of the mental health panel. So